Good evening, and thank you for joining us for Addiction Talk. This is our first episode of the season for 2024, and we really wanted to bring you a powerful panel discussion tonight. With so many people struggling with substance use disorders, we wanted to talk about the future of addiction treatment. Take a listen. Our guests today are at the forefront of addiction research and advocacy. Cure Addiction Now founder Nancy Davis, director of the Drug Discovery Institute Paul J. Kinney, and MTV's Laguna Beach and the Hills star Jason Wahler are sharing their insights on the future of addiction treatment, including the use of widely popular medications Ozempic and Wegovy to combat addiction cravings. Addiction Talk starts now. And I'm joined by my panelists tonight as we delve into the future of addiction treatment, where we're headed, and really advocacy, because while we have made strides, there's so much further to go. So I want to thank my panelists for joining us tonight. Of course, we have Nancy Davis, who's the founder of Cure Addiction Now, Dr. Paul Kinney, who's on the forefront of many of the research efforts that are out there, particularly looking at some of the weight loss drugs and how they could potentially be used for the treatment of addiction. And of course, Jason Wahler, you know him, TV celebrity who is also on the board of Cure Addiction Now, but really an advocate for research and for more funding to go into newer treatments. So thank you all for joining us this evening.
Thank you so much for having us.
Well, Nancy, I want to start with you because you are the impetus, you and your son were the impetus behind the starting of the foundation, Cure Addiction Now. Tell me about your son's story and how you got into really advocating for more funding for research when it comes to addiction.
I had this most amazing son who was the love of my life. He was incredible. He came to me one day. He'd been an addict off and on for like 12 years. And he said, "Mom, I have this horrendous disease and nothing exists that's helping me. I don't do well on AA. I've tried it so many times. It's not working for me. It works for some people, but it only really works for 7% of the people." He goes, "We need to do basic science research to understand why is your brain craving drugs. Some people can try drugs here and there, drink here and there, they don't become an addict. Other people try it once, a few times, and they're a slave for the rest of their lives to addiction. And it's a really terrible disease." And he said, "Mom," he'd always help me. I have a charity for it's called Race to Erase MS for multiple sclerosis because I suffer from MS. And Jason always helped me over the years since he was a little boy, coming up with lots of medications. When we started, they told us there was no known cause, no cure, no drugs on the market, and there never would be for MS because it was a very unpopular, impossible disease. Jason was a big Pied Piper kind of kid. He always helped me. Today, there's 25 drugs on the market to help stop the progression of MS. He wanted to do the same thing and use the same model where we would get 8, arguably the best doctors in the country to work together as a team to always communicate, never duplicate research so we could get there a lot quicker. And we would actually figure out why does some of these medications work for some people? Why does it work for nobody? And how can we come up with better things so that everybody is served? Everybody has their own personal journey with addiction. I'm not putting down anything that has worked for anybody. I think it's great, but we're not helping enough people. Jason was one of the people that the things that existed did not help. So we set out, and it was really important to him to work on cravings. And so we founded this whole thing called Cure Addiction Now, or CAN, with the idea that we will come up with medications in different ways that hadn't been developed before. So for about 25 years before we started this, there was very little basic science research that was going on. And our goal was to find a lot more things that we could get out there so we can help everybody, not just a few people. Some people do great with, AA or going to rehab, whatever. That's wonderful. But like, he wasn't one of those people. And, only 7% of the people get better that way. So what do you do with the other 93% of the people? You need to find other options. And there's so many different kinds of addiction. So we got our 501c3. We had a great meeting in New York that both Jason and Dr. Paul Kinney were all at. And Jason was really excited. So we'd gotten our 501c3 and we really were able to start playing ball. Unfortunately, 4 months later, Jason died. And I miss him so terribly. He was so much fun. He was just the light of my life. He had problems, he had troubles that were all, based around addiction. And I know no matter what, I feel like Jason is that that little person, angel sitting on my shoulder every day, encouraging me to fight this good fight. And I have to do it. We started this during COVID, which was a bit complicated because people were not really having charity events or doing a lot. It was a very kind of rough, dark time. He died at the very beginning of COVID on February 16, 2020. And so we've been really working on this. And we have some really exciting things that are going on that are very novel ideas that nobody has ever bothered researching. And I'm so excited that we have such a brilliant team of doctors that we're able to do this. We have lots of, people supporting us in different ways. And we really need to save a lot of lives. And we need to find out also ways our charity works on taking the stigma away and the shame. There's so much shame that exists with this disease. And it's really unfair. I have multiple sclerosis. Nobody has ever shamed me if I tell them I have MS. My son telling people he had an addiction, they shamed him. They made him feel bad. He didn't choose to have an addiction. He didn't choose for that to be the story of his life. It happened. It happens to lots of people. We need to stop making people feel bad. If we could help people right off the bat when they're first diagnosed with this disease, not to go down this terrible rabbit hole, to empower them, to give them tools to deal with their disease, we will end up in a better place. People do not need to feel bad about themselves. They just really don't. And so that's what we're doing. And it's also half mental illness as it is an addiction. You can't cure one without the other. You have to deal with, some people had a mental illness that caused them to become an addict, or vice versa. Because they were an addict, they became mentally ill and incapacitated in different ways, or had a lot of PTSD. So we're all about making the whole thing go together. You can't cure one without the other. You have to deal with the whole thing. And we're not here to shame anybody with a mental illness, an addiction, or anything. We're here about coming up with solutions, coming up with real medications. And we've come up with a lot of things already. So we have some really exciting studies going on. And I just feel my son Jason's presence every day. He's the reason I did this. I lived around an addict. I know how difficult that is. So many people, I'm sure, watching this have loved ones with addiction, and they don't know what to do. When Jason first became an addict, I didn't know how to get him the right help. I was going, well, I'm so happy to get him into rehab. Well, rehab doesn't always work. What is the right rehab? What is the right place to go? Rehab's a fortune. It's so expensive. People can't afford to just go to rehab. It's a lot. Your insurance very rarely covers it, and it doesn't cover when you get out of rehab to do step down programs and other kinds of things. It's vastly so expensive. And what we found out down the road too is like, I think, half the people working in any of these rehab centers don't have any medical training whatsoever. I think it's actually 40% of people in any rehab or mental institution have absolutely no training. So they're administering medicines and medical advice, and they really don't know how to. So that's another thing we want to do. We want to make these places very credible. So hopefully down the road, when people have an addiction, they could go to a place and have insurance cover it. That would be magical. When I have an MS attack, if I get an MRI, I need blood work, whatever, it's covered by insurance. Why is addiction so unimportant to people that it's not covered? And I think it has to do with some of the places and some of the ways people are treated. We need to make it fair and equal.
Well, Nancy, you are giving us so much. I said, even in that first, because I can tell that you're so passionate about this. And I wanted to touch on some of the things that you touched on, because I think it's really important. Definitely making sure that treatment and options are available for people, and that across the board, treatment centers are receiving, or people receive the same level of care, no matter where they go. But also what you said that I think was so important is delving into that research and looking at how are we treating this, individualized treatments, because no one size often fits all, right?
No.
We need to be looking at different options to be able to help people. And I think it's no surprise to me that today, as we get close to the one or the anniversary of your son's death, that we're talking about that you're continuing the conversation. And my hope is that if someone is listening tonight, that we give them hope, that we share what you're doing, and that we can get behind and support the efforts that are going to really move the needle and save lives.
Thank you. That's wonderful. That's what we want to do. There's so many possibilities and so many options, and I just don't like the stigma and how it's really caused us. Our government funds every other disease known to mankind. They just do some things that are kind of silly if you think about it. And this is the leading cause of death for people 50 years old and younger. It has attained that status since COVID. And why are we looking the other way? Why do we not put the importance on this disease? If you have an addict in your family or whatever, you love that person, you love them wholeheartedly, you want to help them, you want to save them. There should be so many options. And why do we look the other way and not develop them? So that's what we're doing.
Do better. Yeah, I mean, I think what you're saying is so true, Nancy, that when it comes to addiction, we've got to do better. And why is there the discrepancy? Like you mentioned, you had MS and people didn't judge you, and you were able to, come up with research and studies to now that we have 25 drugs out there for MS. And if we could do the same thing for addiction, more options, how that would be. So I want to ask some of our other panelists that are here tonight. Jason, as someone who's struggled with addiction, what made you want to get behind this? And what are people, I know you have your ears and eyes to the ground for people who are struggling, and what are you seeing out there? Are people getting better? Are we making any strides? And what made you say, I need to step up and do more?
Yeah, I mean, well, like Nancy said, this is the leading cause of death in America for 50-year-old individuals and younger, right? And so addiction is primary, it's chronic, it's progressive, and it's fatal if it's untreated. And so I think it's imperative that we look at this. And unfortunately, I wish we could say things were getting better, but if you look at the polls and you look at the amount of deaths and overdoses, suicide, everything that kind of ties together for mental health and addiction, it's only getting worse. And so to Nancy's point, for me, I wanted to get involved with something like this because not only did I have my own struggles, and did not only did addiction take me from not contemplation but attempting suicide and literally robbing me of my life, but it also really impacts over half of my family. There is a pregenetic disposition to this, and for me, it's something I really want to see a change in. I'm sick and tired of seeing people in the bondage of this and not having a way out. Because like Nancy is saying, I'm very grateful I'm on the other end. I was able to actively arrest my disease, get sober and have recovery. But there are millions of people that are out there that are still struggling. There's also millions of people that don't even know that they struggle with addiction. And that's what's crazy to me is, I mean, a lot of the stuff that we've done, boots on the ground and raising awareness, is even educating on people on what is addiction. How do I know if I struggle? What if my son or daughter is struggling? What are the signs and symptoms? What do I do for them? And so I think, again, is we have made tremendous progress over the last 20 years. I mean, just as a society, and especially when it comes to the stigma that's associated with it, that's obviously it's starting to get smashed. There's a big hill to still climb, but the disease of addiction does not discriminate. And there's more that needs to be done. And partnering with Nancy is something for me that meant a lot to see the mountains that she moved when it came to multiple sclerosis. I knew if somebody could make a shift and or a move, it was Nancy. And to work with these doctors and these researchers to see what they're coming up with and actually funding the research to make a difference is something that is completely imperative to me. I can't believe when I met Nancy and we were talking around, how much research has really been done towards addiction. I think one of the first things that she stated to me is, and this isn't a joke, there's literally more research done around toenail fungus than there was addiction. It's something to look at, and it's just mind boggling to me. So it's important to be connected in all areas of this.
I think that is mind blowing. I mean, just to hear what you said, Jason, that there was more research for toenail fungus than something that is a leading cause of death in this country. So I want to go to Dr. Paul Kinney, because Dr. Kinney, why do you think there's not enough research? Why hasn't there been, with all the deaths that we're seeing, with all that's going on, why do you think there hasn't been this big push to say, let's put hundreds of thousands of millions of dollars behind this so we can come up with the best treatments and possibly cure this disease?
Yeah, it's a great question. I think that this initiative from Nancy is really critical to address that issue. We need more research. We need more interest in supporting the research. The National Institute on Drug Abuse has done an amazing job, really single-handedly, in growing an addiction research community in the United States. But clearly, we need more. help, more researchers. I think what we also really need is a willingness on the back end from big pharma companies that when we find things that we think are relevant to the mechanisms of addiction that are helping to drive the process in the brains of those who have a substance use disorder, that we think that information is important, that we can intervene with new medications to help treat, stop the addiction, that pharma get behind us and that they're willing to help develop the new medications that are so desperately needed. And that hasn't been the case ever. I mean, there has been no big push in terms of really trying to take the basic knowledge that we're accumulating. I think it's a really exciting time for addiction research. It, as Nancy said, and Jason said, it's a small enough community, but it's a vibrant community. We really are understanding a lot about the mechanisms of addiction. But for this to mean anything, that information, that knowledge needs to turn into new effective therapeutics. And we just don't have them at the moment.
And, you know, I want to go to Nancy, because when we think about the groundbreaking research that you're doing and you kind of filling this gap, because we're saying there hasn't been a lot of research up until this point. Tell me some of the research studies. What are the areas that you're looking at, and where do you really hope to make the biggest impact?
Well, we're trying to work on cravings. How do we stop cravings? What's going on in your brain? Why do some people crave it so intensely that they have to answer to that all the time? So we've done a lot of different studies. There's one medication out called Balsamra. It's a sleeping pill that's non-narcotic. So let's say you got sober, you could take this pill, and it's pretty amazing, and it cuts your cravings between 50 and 80%, which is kind of a miracle. Very often, if you give a sleeping pill to an addict who's just recovering, they're probably going to get addicted to sleeping pills. So this is something you can't get addicted to, but it has another end to it. So we've invested in another study with these people where they're going to double the amount of the medicine that makes your cravings stop, and hopefully it will allow you to sleep after you've gotten sober, and it will cut your cravings more like 80 to 100%. That's very exciting. We're working on something now that I'm really excited about with vaccines. During COVID, so many vaccines became available, and it became an easier way to produce vaccines. So we're working with somebody right now who's working on an opiate vaccine, which I think is exciting. And the idea of the vaccine is that you would take a vaccine once and it would stop your cravings forever. And if you still got high, it wouldn't allow you to get high. So, which is kind of interesting. Ultimately, we're working on a vaccine that we'd like to give to anybody if that runs in your family, to give a child when they're born, a baby, if you have a susceptibility in your family. I know many of us have the susceptibility in our family. We're terrified to look at our children and say, you know, they could become an addict and this could happen to them, and it's awful. So the idea that we could come up with a vaccine is amazing. We've been working on another thing that I'm really excited about that makes it very easy and equitable and affordable for everybody to detox and then get sober. There's a couple of medicines being worked on, another one that exists, but it doesn't have FDA approval right now, that would be great for people that don't have to have a ton of money to go to a fancy rehab, and they will in fact get sober, and then it stops your cravings for the next 6 months, which is amazing. And so there's a couple different studies that have to do with that, and we're really excited about that. We're working on ways. Even we all think that when people are so addicted to fentanyl now, you always hear that people are dying from fentanyl overdoses, but a lot of people are also getting addicted to fentanyl along the way, because everything is laced with fentanyl. And if you take somebody to a hospital, an emergency room, you feel like, okay, they're home safe, this is good. There was no protocol we figured out for how to take somebody off fentanyl. It's very hard to get somebody off fentanyl. It takes a really long time, and it sometimes sends people to these crazy psychosis where they they're jumping off buildings. We're inventing a protocol that will hopefully be for everybody when a gold standard that will be, hopefully implemented in all the hospitals to make it much easier to know how to take somebody off fentanyl. Because some people don't even realize they're on fentanyl when they are, because they're on other medication and it's not labeled fentanyl, but it is fentanyl. So that's a very scary thing. So they're working on a better version of Narcan. That's another study going on that will work longer and hopefully be a Narcan that you could possibly keep in your car. Will be temperature resistant, so you could just have it around a lot, and if something happens, you have it. I advocate everybody having Narcan. I think it's a miracle that Narcan even exists, because every drug that anybody buys that is not in the drugstore, there's probably a 90% chance, if not more, that drug will have fentanyl. And the fentanyl is the equivalent of you having like 50 to 100 shots of heroin. Nobody's body can really tolerate that. People die. And if you call 911, it's going to probably take 10 minutes for 911 to get there. But if you have an overdose of fentanyl and you've passed out, you have about 4 minutes to have some brain damage. You have 6 minutes to you're dead. And it's going to take 911 that long to get there. If everybody in their home, in their car, everywhere you go, every restaurant, every Uber driver, every Lyft driver, every bus driver is empowered to have Narcan on them, that would be probably the best thing. In fact, I happen to have it right here, Narcan. This is something, nobody can afford not to have this. Your kids can't afford to go to a party at night without having it. It's a miracle that medication exists. So we want to make it better. We want to also advocate that everybody should learn how to use it. If you've never used it, it's going to be a hard thing. It's a very simple thing to learn how to use, but you have to have it and you have to do it. And so we're doing that. We're trying to be able to give Narcan away to a lot of people so that they will have that on hand in case something happens.
Well, it sounds like you have so many studies. I mean, you just in that few minutes, so many powerful things that you guys are funding and the research for this. And I know, Jason, when you hear all of these things that could be coming down the pipeline, particularly when it comes to the cravings, and I want to get into some of those drugs with you, Dr. Kinney, and how that's looking, but particularly when it comes to the cravings, how impactful do you think it would be to have something that could stop cravings? How much do you think that plays a role, or do you think has an impact on many people continuing to use despite the consequences?
Well, look, addiction is a very multifaceted disease. There's a lot of different elements and angles that come into play. But I think if that is one of the pieces that you could add, again, different strokes for different folks, from what I struggled with versus what somebody else may struggle with, that could be a determining factor for them, right? And so I think it's really important that we address that, because obviously cravings is a huge thing. Especially, I never struggled with opiates, and I know a lot of my friends that had or that were actively in addiction that are now sober, their cravings were so strong. Jason, for example, my dear friend, it's the cravings that they would experience were so horrific, and so to have something be able to mitigate that, almost arrest that feeling or emotion, for them to be able to focus on the recovery process and to be able to get them to a stabilized place to continue to move forward, to be able to engage in therapies, to engage in different, basically therapeutic modalities, that would be instrumental. It's like a stabilization. The way I would look at that is like if you struggle with, for me having OCD, right? If you take a medication that can help mitigate the symptoms, that allows you the opportunity to do the core underlying work. And so that's the way I see if we can help mitigate cravings for individuals, that would allow them to be able to continue to do the work. I think that's definitely a piece of the puzzle. But again, addiction is very multifaceted, and there's a lot of things that we need to look at.
No, I definitely think that. And I want to turn the conversation now. One of the things that we've heard a lot about, and I want Dr. Kinney to weigh in on this, is these weight loss drugs, Ozempic, Wegovy. Of course, they also have some for people with diabetes. But looking at them as a treatment for addiction, we've been hearing a lot of buzz about that. And I know that's something that that the research is looking at. Tell me about your work on that. And is this something that we're really thinking could potentially be a treatment option in the near future?
I really hope so. I mean, we've been working on these systems for maybe over 10 years now. And, we kind of fell into this area, I would say, almost by accident. And the reason being, there's a group of neurons in the brain that we think are really important for organizing behavior, motivating behavior, called these orexin neurons. And the drug that Nancy had mentioned, Belsomra, helps to turn those neurons down. And that's been shown to attenuate cravings in humans who are, addicted to opioids. So those neurons and the neuropeptide they release, we've known about them for about 15 years. And so my lab and some others were some of the earliest labs to work on those neuropeptide systems. We went looking to see what controls those neurons, what turns them on, what turns them off. And one of the groups of neurons that feed into those cells to control them are cells that produce GLP-1. And so GLP-1 is made in the brain. It's made by a group of cells in the brain, and it feeds into these neurons that we know to be critical for drug addiction. So we thought maybe if we modify the activity of GLP-1, that could be good for craving and for drug use. GLP-1 is made not just in the brain, it's also made outside the brain, in the gut. And when you eat a meal, it's released by the gut, and it goes to your pancreas, and it helps secrete insulin. So in other words, it helps your body deal with the increase in blood glucose you're going to experience. And it was that property that prompted major pharma companies to go and develop drugs that would mimic the actions of GLP-1, that would lower your blood glucose. And what else happens when you have a meal in addition to blood glucose going up? Usually you begin to feel full and your appetite suppressed and you stop eating. It turns out if you boost GLP-1, it also tells you, hey, you've had a meal, it's time to stop eating. And lo and behold, you begin to lose weight because your appetite is suppressed. So they're the two reasons why these drugs are developed. You know, they help regulate your blood glucose, they help control your appetite, but it turns out that they also have actions in the brain. They help to control motivated behavior. And it's been known for quite some time in terms of using these types of drugs in mice, in rats, their desire to use cocaine, their desire to use opioids, nicotine, amphetamine, it's just completely knocked on the head by drugs that will boost GLP-1 transmission. So the hope has been for quite some time now, if we can get drugs that are safe for use in humans, in addition to be good for diabetes, in addition to helping suppress appetite, they may actually be really good for the treatment of substance use disorders. So the hope is there, but the data isn't. You know, we know they work for appetite. I mean, that's an experiment that's been done now on hundreds of thousands, if not millions of people. The data is not there yet to show that they are effective for the treatment of addiction in much the way that we would predict that they would be based on animal data, in the same way that we predicted they'd be good for appetite regulation and diabetes, because those big human clinical trials, those human studies haven't been done. However, there's anecdotal evidence. People who use these drugs for, to lose weight or to control their blood glucose, many of them are reporting that they no longer want to drink alcohol, or the desire for alcohol is quelled, not drinking as much. They're using opioids in an illicit manner. They're abusing opioids. Their desire to use opioids is reported to be decreased. So the anecdotal evidence looks really promising, but we don't have these proper, well-controlled clinical studies to tell us this is a real thing. These drugs are working, and we should consider their use in the context of addictions. And I really hope that's the case.
Where are we in that, in terms of that next step? I know you said we don't have enough data when it comes to that. Nancy, is that something that you're looking to fund in that area, where we can have those larger scale studies, so we don't only just have anecdotal evidence that these drugs could potentially have yet another use?
Why I was really interested, and we are funding this study. I'm really excited about it, truthfully. I went on one of these drugs. I went on Manjaro, then on another one, and I wanted to lose weight, and it made me lose weight. But along the way, I think I've probably been a chocolate addict, and I found along the way that chocolate all of a sudden became repulsive. I didn't like it, which is a miracle, because I think I've had more chocolate in my life than anybody, probably more than the Hershey's factory. And all of a sudden, I'm like, wait a minute, this is kind of crazy. Then I started talking to other friends who are, nobody really wants to admit they're taking, one of these drugs, but they're all getting very skinny and whatever. But when you start talking to them, they're all saying, oh my God, I used to have 2 drinks every single night. Now I find having a drink so repulsive. Other people, they're not craving their bad habits. They feel very satiated and very full, and they don't want anything. And I've even heard these drugs are now being used for people with anorexia, which sounds like the opposite of what you would do. But I know a doctor who says she's doing that too. So I think these drugs are kind of like the holy grail for, who knows what could happen. But I feel very positive because of the sheer amount of people that I have just talked to who have been so helped by taking these. They took them to lose weight, but they're also, they stopped drinking. And some of the people smoking and gambling addictions and stuff too, which I find interesting as well. So I think these have a great prospect of doing something, fabulous in the future. So I'm really excited that we are funding this research.
And Dr. Kinney, are you participating in that research that Cure Addiction Now is funding? And if so, I believe you are on that team that's looking at this. Are you guys starting with mice, and then the hope is to go into trials with humans? Where are you at, or where is the research at this point?
Yeah, there's parallel studies. Nancy's been really generous in her support and really trying to, my impression is really focused in those areas that are most likely to yield things that will actually help in the near term as quickly as possible. So my lab, we do some human work, but we're really focused on mouse and rat work because we're trying to identify the most promising targets and understand how well or how they're working as quickly as possible. So what we're working on at the moment is trying to understand how Ozempic and these related drugs are actually working to control the desire to use drugs. And one of the things we found is that, we think of, it's easy to understand how these would work in the context of food. You're hungry, so you have a desire to eat food. But as you eat, you begin to feel full. And so your desire goes down because you feel satiated, the satiety kicking in. We think of addictive drugs in terms of having an appetite because when you use them, they make you feel good. So there's an appetite to consume them. But we very often don't think about them actually triggering satiety systems. And they appear to do that because people typically, they control their drug intake in a very regimented manner because they want to stimulate their brain reward systems maximally without pushing it too far and experiencing negative effects. So the idea that we're testing is that there is such a thing as drug appetite, and also conversely drug satiety. And so if we want to treat addiction, one way is to turn off the appetite. Another way is to turn up the satiety, where you don't really feel the desire to use them anymore because you're already sated. And that is exactly what we think these drugs like Ozempic are doing. They're basically dialing up the satiety signal. So either when you use the drugs, very quickly you're done, so you use much less. Or if you turn that system up really high, it's almost like you've already eaten. You're like, I don't need to eat anymore. In fact, it would make me feel ill. And as Nancy said, many people feel that way, even thinking about using alcohol or thinking about using opioids. It actually makes them feel, in some cases, nauseous because those satiety systems have already been engaged. So we're trying to work at the moment to help understand that and then better design human clinical trials. And the design is critical because you could have a wonderful drug that will actually work, but if you don't ask the right question by designing the clinical trial properly, you could miss something really important. And quite often you only get maybe one shot on goal, one chance to do this, get a good signal, and then design the much bigger trials to phase 3, which are super expensive. So we want to do the best job we can to help our clinical colleagues design the right human clinical trials. So hopefully they can generate the positive data that we need.
If all goes well, in the perfect world, how far out do you think we would be, Dr. Kinney, from this idea of us researching and asking the right questions till something would actually be on the market or be approved potentially for this use?
That's a really tricky question. So
I know that's a hard one.
No. I mean, it's a straightforward. I mean, in an ideal world, all things being just perfect, a clinical trial is run. It's a really comprehensive, well-done clinical trial in a phase 2. So you ask if these could potentially work. You get positive data. Then you run your big comprehensive phase 3 involving thousands of people. You get positive data. It's ready to go within, maybe 18 months, which is amazing. In the real world, these drugs, in addition to maybe you won't see the signal you want, maybe there's all these other complicating factors. Access to the drugs are controlled. The people who've developed these drugs are big pharma companies. They're developed for specific indications. You need buy-in from those companies too. They have to be willing to use their drugs that they've developed in the context of substance use disorders. That's an open question whether they'll be willing to do that. And I think that's going to require this initiative, Cure Addiction Now, and hopefully some federal involvement to some level to encourage big pharma to say, this is a really important problem. People are dying, and if these drugs potentially work, they don't need to die. They shouldn't die. These drugs should be used for this purpose. And that conversation hasn't started yet. And I really hope that we'll have the data to support that conversation and that big pharma will listen and do the right thing.
You bring up a very important point, like getting big pharma to get behind this, but also starting the conversation. Jason, when we think about the fact that there hasn't been a lot of funding, do you, in your opinion, from someone who struggled with addiction, think that stigma has played a role in us getting the research and the resources we need to really push some of these newer options or potential medications to the market?
Yeah, I mean, I think the simple answer is yes. I think that, people still to this day, but again, as I stated earlier, as it's improving, but people that struggle with substance abuse or alcoholism or addiction are looked at differently, and as we know today, though, is that it affects all socioeconomic backgrounds, from the top to the bottom. But I definitely think stigma is played a key role into it. I mean, because when you look at it, there's enough, when you look at the factual human data that this is causing, and the amount of people that are dying from this every year. I mean, like it's mind blowing to me. It's nuts. I mean, just going back to even why it was a part of this is just look at all the stuff that is being done with a foundation. I mean, there's so much more that could be done on such a bigger level. And to me, it's just never made sense as to why. There's more people dying from this than a lot of other things that have a lot more attention and or research going to it. So for me, I think yes, but I do think that there's a stigma associated with it. I think it has been the lack of research, but I think that is the table is starting to turn now. We're starting to bring more light to it. And again, such as the doctors that we have on and Nancy and the board, I think we're really going to be making a shift here to bring light to this and hopefully continue to smash that stigma to be a beacon of hope for those that are lost.
What do you think, Jason? I want to ask you this, has been the most effective strategy for squashing the stigma? I know you said you're starting to see some change in that tide. I know more people are speaking out about this, celebrities such as yourself admitting they have a problem. What do you think it is? Do you think it's more people sharing their stories? Do you think it's us looking at addiction now as a disease versus a moral issue? What do you think has starting to shift that mindset for America?
I think to create systemic change, I believe the conversation's got to be had, but I think everything that you touch base on is imperative for the shift with this. But I think it's a combination of multiple things. Yes, the most simple thing anybody can do is talk about it, bring awareness and light to what's going on, because the more that you talk about it, right, by expressing vulnerability, it creates humility. And when you start talking and sharing, there's very few conversations that I have now in my life that I don't run into somebody that, whether them, their wife, their husband, their friend, somebody's going through something. I mean, everybody's affected by this. So I think that's, is starting the discussion, but even more so is looking at the research and having, true data behind this to be able to back all of this is also going to be a key indicator in that. But, I think right now it's the way that I'm seeing is I think that it's bringing light to it as more people are talking about it.
Yeah, I think so too. And that's why, we started Addiction Talk to have panels like this, to have people to share their stories. And so I think, like you said, the more we talk about it, the more people realize this is their mothers, their fathers, their neighbors, their children, that this is happening to so many people, and that this really is a disease, that we can start to change that narrative. So Nancy, I want to go back to you because, when I think about what you and your son have created, it is amazing. I mean, the fact that you've been able to get research going, funding going for this research is huge. How hopeful are you that we could eventually have a cure for this disease?
I guess I wouldn't be doing this at all if I didn't know we were going to find a cure or many cures, because there's so many layers to what a cure might mean. And even with MS, we can never identify what does a cure mean. But we have to try our best. We have to try our hardest. We have done nothing. There's so much to go. We need to raise a ton more money. I mean, we need to raise a lot of money, and we're doing, everything that we can right now, but it's complicated. And I think it's also getting people to understand that it's okay to talk about it. When you talk about it, then people all of a sudden start opening up that this happens in their family, just like Jason was saying, their mother, their father, their aunt, their best friend, the friend's child, everyone's suffering with this in such silence. And I think that the ways we've had to treat people are so inadequate, and it's so unkind, and it's so unfair. And to put all these people in a box who have a disease, if someone has cancer, all of a sudden, you're gonna be able to afford to get over cancer, but you can't get over this disease because maybe you're less of a person, or you're not perceived to be a good person. Maybe you're a bad person. Maybe you're scary. Maybe you're dangerous. A lot of things happen when you're an addict because people cut you off. When you leave rehab, usually the only job you can get after that is working in a rehab. It's very hard. Then our rehabs are, it's a lot of people who are kind of on the cusp of maybe falling off the wagon. It's not a great model, and it's not fair to be prejudiced against somebody who got out of rehab, who's gone through a terrible illness, a death-defying illness. I mean, it's as dangerous as any cancer out there, and to make them feel that they should be ashamed. Nobody should be ashamed. You're born a certain way. Everybody's brains are wired differently. I'm very, I'm not an addict as such. I'm so scared to death to try because I've lost people who I love and care about. So I'm very likely to never try anything. I know lots of other people, young people, whatever. It's out there. A lot of people are trying drugs for the very first time in their life, and they're dying. A lot of these kids are going on TikTok or Snapchat, and they're able to click on the emoji that looks like an electrical outlet. And if you click that on, all of a sudden the menu from all the drug dealers comes up, and you can have that drug dealer, bring this drug to your house immediately, and you can pay for it with your Venmo account. The parents don't know. It disappears off of, the computer immediately. And these young people are in their bedrooms. Their parents are walking in, and they're 14 years old, and they're finding their kid dead who tried drugs for the first time. People are dying that are not addicts. People are dying who are addicts. It is out there in such a big way. We need to have a conversation. We need to be honest. We need to not ever make anybody feel bad that they have a disease. I was never made to feel bad because I had MS. And I don't think it's fair that anybody that's an addict should feel bad because they don't wake up one day and say, hey, I think I want to be an addict today. Right. No. And they don't want to have MS one day, and they don't want to have diabetes one day. This is your body. This is the body you're given. This is the chemistry of your body. It doesn't matter. You're not a less of a person. You need a lot of love. And this idea of, pushing people away because you're saying, oh, I'm afraid of an addict. They're going to steal from me. They're going to do this. They're going to do that. Don't push addicts to the point where they have to do that. Let's love them. Let's embrace them. Let's find cures. Wouldn't it be great? In my head, I think the greatest thing that could possibly have happened is that we will find a medication or a vaccine, and that parent's child has gone to their first, big party. They had their first drink, and all of a sudden the fireworks are going off in their head, and they can't get enough drinks, or they can't get enough drugs. Wouldn't it be great if you could take your child to a doctor, and insurance covered it, and they gave you a vaccine or a medication, and it would stop you going down this rabbit hole for your whole life of this thing, or making you feel inadequate or bad or unloved or unwanted? I mean, it's not fair that we should push somebody away. I mean, we should not push anyone away.
I mean, that's powerful. What you said right there, Nancy, was so powerful. Just to think that a parent wouldn't have to worry if we got to the point of, like you said, vaccine and things like that. But one thing that you said that really hit me is we need a lot more funding for this and what you're doing. So just to give people an understanding, to fund an average study, how much are we talking about? How expensive is this? And how can people support what you do?
All right. Well, we fund these studies by the year, and they're $75,000 a year. We usually fund them for at least 2 years, depending on what the study is. So let's say $150,000 a study. That's very inexpensive compared to a lot of other universities, and the amounts that they're charging to run a study. We're very lean. We run them very carefully. We know exactly how to do it in such a way that we're not wasting any money, which is incredibly important to us. We do not want to waste money ever. And we really, we know how to do this. We have the best of the best doctors. We just don't have enough money to fund all the studies we would like to fund. And we're funding 14 studies right now, which is kind of a miracle. We haven't had a real live event We're going to have a thing in Los Angeles in March, which is going to be, very exciting, and talk about all that's happening in our addiction. And it's going to have all our doctors here, and they all come and collaborate. They're here for a couple of days, and we have this amazing forum. But one day they all just meet together in something called the Center Without Walls, which is a great forum because they can really, collaborate on different information that they're seeing at their different centers. And it's nice that they have the ability to be together. This, I think, never existed at all for addiction. It's something I have done with Race to Erase MS for a lot of years. And the magic happens when they're all sort of, locked up in these rooms together for the whole day, and each presenting their brilliant studies and asking personal questions about, how things are formulated and whatever. And so it's our hope that all this magic will happen. And there's so much to do. There's so many things to conquer.
Wow. Just to hear the number, 14 studies, Nancy, that is huge. And so as we wrap up tonight, how can people, and I want to give everyone, of course, a chance to make some final statements, but Nancy, from you, what do you need from the public? How can we help? What can we do as a community to support your efforts for this research and for the advocacy to end the stigma around this disease?
What we would love more than anything is donations to Cure Addiction Now, or CAN. Here's, I guess this is what our little brochure looks like. I'm doing this the wrong way. It has a little thing about what's going on. They could go on Cure Addiction Now, or go to info@cureaddiction.org and find all of our information. We love a donation more than anybody. Send us notes. Send us some ideas if you have other ideas of what we're not conquering. We know there's a lot to conquer. We want to do more. We love people's stories. We want to get, in a nutshell, the easiest thing we can do is get more money to fund more brilliant studies with people like Dr. Kenny and our other brilliant team of doctors. We're so grateful to have Dr. Kenny, and he comes to us with just, years of great expertise. There's not that many doctors that are in the world of addiction research. It's kind of fascinating. When I set out to do this whole team of doctors, it was really hard. And I found him through the guy who's the head of our scientific advisory board now, and he really knew Dr. Kenny. But I was having the hardest time even finding doctors who really did this. It was kind of crazy. When I set out to start Race to Erase MS, there were so many doctors. There was so much research being funded. We hadn't gotten anywhere, but it was happening. And it's such a shame that the doctors like Dr. Kenny don't have the tools that they need to do brilliant research. And we need to change that really fast, because more people are dying of this disease than any other disease. And we can't just keep turning our back, pushing it under the rug and not paying attention. And even the amount of, people getting fentanyl on a daily basis. I don't know how nobody's alarmed by, how this is coming to everybody. And it's like, if you buy any medication that's on the street, not in a drugstore, you can be sure that you're getting fentanyl, which will probably kill you. Especially if you don't have, Narcan on you. You have to be smart, but why do we allow this to happen? Why are we allowing it in such a big way? We have to get real about this. And everybody just says, well, look the other way. It'll go away. It doesn't go away. When it happens to someone you love, it's there forever. It's an indelible, horrible print on your heart. And it's a terrible thing to ever have to deal with. And the idea that we just don't care enough, it doesn't work. We have to care. We have to be passionate about it. When something is the leading cause of death, why is there so little money going to it? Why is our government and everybody just like, they don't care? We have to care. We have to save lives. We have to save people we love. And that's all there is to it.
No, that's powerful. And I just think about your son when you said that leaves a mark on your heart, Whew, that was, as I think about what you said. And I just hope people who are listening tonight realize that this is something, it's not just one person's problem, it's an all of us problem. And so as Dr. Kenny, as we wrap up, one of the things I want to ask of you is, how can we stay informed of the research and the things that you're doing? Because it's really fascinating that you're studying these, weight loss drugs that could have greater benefits. How do we stay in tuned and figure out what's going on? And, even let our government officials know, hey, this is something we want. We want to see more information out and more research about these potential treatments.
Yeah, Cure Addiction Now, the website, the annual meeting, the Center at Walls is a great format for that. We get together, we report on the work that we've done over the previous year. We talk about ideas, where the next thing may be. And so Cure Addiction Now really is a great format for learning about this. There's also press releases from the National Institute on Drug Abuse, NIDA. So they do a great job in picking what they consider most impactful work and translationally relevant work and trying to highlight it. So I would strongly encourage anyone who's interested to go to the Cure Addiction Now website and the website for NIDA, National Institute on Drug Abuse, 2 great resources.
Well, thank you, Dr. Kinney. And finally, Jason, I want to end with you. You've put your platform behind this. How are you hoping to use your platform to generate more awareness? And what do you see is the greatest need at this moment?
Again, it's stuff that we've been talking about and we continue to repeat, but it's just the conversation and trying to draw more people in and connect with other individuals to share and to talk, because when they're open and vulnerable, it allows people to let them know that they're not alone. And I think that's the biggest thing is there's so many people out there that feel alone, and they're not. There's so many people that are struggling, and there is a way out. I think that's the biggest thing. And so from my side is I try to share as authentically as I can as a person that was, arrested multiple times, as a person that went to 12 different treatment centers from Florida to Hawaii, every state in between, that tried to even take in his life, that you can completely turn that around. I got an amazing family, a beautiful wife, 2 kids. I found a purpose. I found a passion in my life today that I love waking up to every single day. Addiction robbed me of everything. And today, my greatest deficits have become my greatest assets. And so I hope to be able to share that with people to give them just that glimmer of hope.
I love that. Leaving on a note of hope. I think your story is a message of hope. And I love what Cure Addiction Now is doing. And I'm grateful that there are people like Nancy and Dr. Paul Kinney and Jason who are saying, hey, we're stepping up to the plate and we're going to do something about it. And I want to thank you all, Dr. Kinney, Nancy, Jason, for joining us tonight, for sharing your information, for giving us hope, for giving us insight, and for raising awareness about this deadly disease that's taking far too many of our loved ones. Thank you again for joining us. Everyone who's listening, make sure you go check out Cure Addiction Now. Their website, as they said, you can find information, you can support. They keep you updated on the latest research studies that they're doing. But all of us, this is a problem that impacts all of us. It's not just one person's issue. It's all of us together tonight. Thank you again for watching another episode of Addiction Talk. Good night, everyone.